So this multidisciplinary and interdisciplinary model allows you to look at a problem from very many different perspectives and many different areas of expertise.
I think why it works as well as it does for us is that our clinicians, our providers, our administrative staff sort of understand each person's role and contribution in terms of understanding children.
I really appreciate that at NeurAbilities there's different professionals. So we have the medical team that knows so much more than I could ever learn about how the brain works or different types of anxiety, depression, seizure disorders, anything in the medical realm that I appreciate is a very real cause for why behavior occurs, but I don't know how to tackle that. So having the medical professionals to help with that. And then on the clinical end, having other BCBAs I can turn to, our clinical support with our clinical directors, our behavior team, all coming together to come up with a solution to an issue that we might be facing.
If you could really look and see and utilize, let's say, a clinician like myself who's a neurologist, approaching things more from a neurological and medical side, and then utilize a behavioral analyst who could analyze these behaviors and understand, are these behaviors being driven by a biological issue, or are they being driven just by some environmental problem? And then you could come up with a much better solution.
So we have a client who has very high significant behaviors, to the point where a lot of them are very dangerous self-injury. So our behavior analyst was able to take that story and the frequency and the functions of the behavior over to the medical team to really work with them to see how we can support this family and really talk about a higher level of care.
I worked with a client who was having seizures, absent seizures, and we weren't quite sure that they were happening. So there's moments where we were sitting there and the client, we'd ask them a question or give a demand and they weren't responding. And they went and saw neurological doctors and they found out that the client was having absent seizures, and that's what they were having when we were giving his demands and everything. So we finally were able to understand, oh, he's having an absent seizure, he's not gonna be able to respond to us, and then we weren't counting that against him essentially, but we were recording those seizures to help them better understand the seizures as well.
So to accomplish this required gathering an array of clinicians and other staff members that are focused on this population in various types of disciplines that normally would have been very independent, but now can work together as a group and as a team. And that team approach, that multidisciplinary, interdisciplinary approach is really what's key to our success and key to our patient success.
We could work with physicians, developmental pediatricians. There's an endless list of specialists that fall into NeurAbilities that's only an email away. It's only a knock on the door away. Whereas outside of that, it might just be behavior analysts talking to each other. This just widens the field. It brings in so many voices, so many insights, and professional knowledge that just one person doesn't have.
The benefits of what we've created really is in our patient outcomes. We've had many, many individuals who've been to many top institutions around the country and locally, and just have not gotten the answers that they're looking for. And we have been able to provide them, at least if not the answer, we've been able to provide them a better outcome. Because we're very persistent. We're very persistent. We don't give up. We continue to search. We may not find something the first time, but we continue to stick with people and stick with their issues and try to come up with answers and better solutions. So it's really a combination of being very vigilant about understanding causes and contributions to these issues and coming up with solutions based upon those causes and contributions, and not just trying to suppress symptoms, but really understand the causes of those symptoms. And outcomes can be much better when you do that.